Hi there, Tina Keeler with StellarNursingStudent.com, and today we are going to be talking about getting started in the nursing profession and choosing the right undergrad nursing program that will fit you. So there's three ways actually to become a nurse. There's a diploma program, an associate's degree, and a bachelor's degree. So a diploma program was very popular about 30-40 years ago, and usually it was sponsored by a hospital or an institution, and it was very skills based. It was about a 2-year program. There are still some around in the United States today, but they're less common. The other two main ways to become a nurse is an associate's degree, which generally is community colleges for your area. Also a bachelor's degree, which tends to be more university or state schools. So an associate's degree is usually 1 year of prereqs and then 2 years in the program. And then a bachelor's degree is usually 1 year of prereqs and then 3 years in the nursing program. So once you're done with whichever program you choose, you take your NCLEX, which is a great big test that gives you your nursing license. And so it doesn't matter which path you take the same NCLEX test, no matter if you went through a diploma program, an associate's degree, or a bachelor's degree. So it all comes down to one test. So when you're choosing a program, you want to choose the program that will help you to be the most successful on that test and in your career. So a good nursing program actually has 4 components, and different mix of these 4 components, but a good program will have all 4. The first is traditional classroom setting, and that's where you're going to learn nursing theory and write an APA paper and turn in an assignment and listen to a lecture and do presentations. That's the traditional education portion. The second portion is your skills lab, and that's where you go in and you're going to work with mannequins and task trainers, which are like, different items that'll help you learn a task or a specific skill. So like IV starts and dressing changes and sterile technique, and all of those things are learned in the skills lab. So then the third component is simulation. Hopefully you're going to be able to take the theory and the parts of the traditional part of your education, pair it with the skills that you've learned in the skills lab, and then go into simulation and be able to demonstrate it. So usually it's with like a mannequin, or maybe it's called standardized patient, but it's just an actor that they set up a scenario. Kind of like a really great simulation would be like CPR. When you took CPR class and you're working on the mannequins, those are simulations. So sometimes the nursing program will set up a simulation for a specific thing that they want to test you or quiz you on, or just to see if you have competency. So then the fourth part of a good nursing program is going to be your clinical rotations. And this is where you're going out into the real world. And the reason we've done simulation in the skills lab is to make sure that you have practice before you go into these clinical rotations. And usually it's in a hospital, but sometimes it's in a clinic or a community setting, something like that. And there's going to be a certain number of hours that you have to complete in order to graduate from the program. So look for a good balance of those types, of all 4 of those things. Your program should have at least some of all of those, and not be too heavy on one portion and nothing on the other. So when you're asking yourself, what school do I want to attend, or which one am I looking at, I want you to see if the school has what you need to be successful, and do you feel supported? So first question is it affordable to me? Do they have scholarships available? Is there any tuition breaks? What can I do to make it affordable for me to go? Second part would be, is it a quality program? Are they accredited? Accreditation is very important for nursing programs because it validates that they are a quality program. They come in and they kind of look at everything and they tell them if they need work on something or if they don't. And if they give their stamp of approval, then they're accredited. So you want to look for an accredited school. Also, do they have strong academics? Ask. Go in as a tour ahead of time and say, what's your NCLEX pass rate? It should be in the 90th percentile. If it's lower than that, you need to be asking why. And you need to, because you don't want to spend all this time and money in a program and not pass that test. That test is important. Also, when you're going to choose a program, I want you to say, do I feel supported here? Does the faculty support me as a student? Am I going to be successful here? Do they care about me, or am I just a number? So I want you to choose a program that fits you. Also, I want you to ask, what resources are available to students? Do they have a student success program? Do they have student services? Do they help me with my resume? Will they help me with interview questions? What are the externship placements? Do they help me get an externship? Do they have a writing center? What is available? What tutoring do they have for me? Are the clinicals local? Do I have to travel? Do I have to get transportation or parking permits? Or what's the situation with clinicals? Also, what expenses are involved? Like uniforms, do I have to pay for uniforms? Are they provided by the school? What about stethoscope? What about a lab jacket? Any of those things are expenses, and so you need to kind of factor those in. So there's lots to consider here, a lot to consider, and I just want you to find out what fits for you. And everyone's unique, everyone's path looks different. Nobody's path, two people are, the path is the same. So find what fits for you, ask these questions, be prepared, dig the well before you need the water, and visit my site at stellarnursingstudent.com for more tips and tricks. And until next time, have a great day.